Good morning as people are coming in. Just want to thank you for joining us for another episode of Downtown Download. Have some very timely information for you today, so really excited to share. Just let everyone get in. Dr. Maine, we will be coming to you in a moment. Excited to share all that you have to offer this morning.
Forward to it.
We are excited. So I don't want to take too much time. Good morning to everyone. Welcome to Downtown Download. I'm Downtown Partnership President Shelonda Stokes, joined as always by Councilman Eric Costello, and we have another timely episode for you. So thank you for taking the time to be with us. You know, downtown is home to several world-class medical facilities that are leading the COVID response for Maryland and helping produce vaccines that will make a difference around the world. So like everyone else, our hospitals had to throw their business models out because of COVID-19. But this morning, Mercy Health Services CEO, Dr. David Maine, will take us to the COVID front lines and explain how patient care, staffing, and operations have all changed as a result of this crisis. So we know there are a lot of questions right now, especially when it comes to COVID and the vaccine. We'll ask Dr. Maine about the vaccine effectiveness, the status of the rollout, and how new variants of the disease may affect the future. But first, I know the councilman and I have a few updates to share. I know you guys, if you know me, you know the excitement that we shared last week with our team coming off of a big week. We launched a new initiative that we're calling Boost. It stands for Black Owned and Operated Storefront Tenancy. This program is presented by Fearless. And one of the things that we're really excited about is this was a true collaborative effort with our property owners, with business partners, with the philanthropic community, everybody coming together to figure out how to do a couple things. One, we wanted to make sure we were really paying attention to the vacancy rates that are in downtown, creating opportunities to showcase our beautiful ground floor retail spaces. But at the same time, we wanted to show our intentionality around the support of Black businesses and really helping ensure that our downtown is reflective of the demographics of our city. So thanks to Boost, Fearless, BGE, we know that we'll be able to provide those businesses with up to $50,000 in grant support for capital and operating expenses. And we'll also be able to provide a robust cohort of experts. And that's for things like accounting, contracts, marketing. You know, the program is unique because it promotes new businesses, fills empty downtown storefronts, and it adds that lens of racial equity and safety. And so I want to, especially give a heartfelt thanks to Mayor Scott for participating, Council President Mosby, my board members, Councilman Costello, Delali DeRaza of Fearless, Lucasaurus of Artemis Properties, along with Rodney Odoy from BGE, all for just supporting Boost. So thank you, thank you, thank you. And I have to give a shout out to the economic development team, especially the director, Sam Story, but our entire team for their leadership on this initiative. So you'll get all of the information about Boost. I can do this whole episode dedicated to that. I won't. But we have an online application on our website, godowntownbaltimore.com. And I encourage you all to share the information. This is just the start. We know this was not the end all be all, but with all of us working together, we will get through this thing. So up next, Councilman, I know you may talk about this a little bit as well. Just wanted to make sure that we notified our bar and restaurant owners about BDC's new $3.9 million grant program to help restaurants and taverns recover. This is another effort that's coming out that's really providing grants from $10,000 to $50,000 for them. And so the application period, we know, closes in 10 days. And so we encourage people to go to BaltimoreTogether.com. On there, it's a thoughtful process. They're waiting for all of the applications to get in. So the money will not run out that way, but really we encourage everybody to apply. So Councilman, that's all I have today. Can I bring it over to you for some additional announcements?
Yes, ma'am. Thank you, Shelonda. Great minds think alike. Of course, I had some information on the Baltimore Restaurant and Tavern Grant. I'm going to punch a couple of quick updates in the chat window for everyone. Bear with me for one moment. And I will walk you through each of these. First is a link to the state of Maryland's vaccination locator tool. If you're looking to get vaccinated, you should start with this tool. Number two, I want to thank one of my colleagues on the council, Councilman Isaac Yitzi Schleifer, for putting together some helpful information on getting the vaccination. I actually plagiarized this text from his website, but I thought this was the most concise way to put it for our residents who are over the age of 65. So the information there's a form that you can fill out as well as a phone number that you can call. The Mayor Scott, excuse me, introduced the new vaccination dashboard in conjunction with Health Commissioner Jaraza. I would encourage everyone to check that out. There's a lot of great information on there. Really delves into demographics, whether or not the vaccination has been distributed equitably, age groups, et cetera. So some really good information there. And then, as always, is Baltimore City's page on the vaccination. As I've mentioned in the past, there's a lot of information there. So if you're looking to get up to speed on what the city's doing, please take a look. Keep in mind, there's a lot of info there. So I'd set aside 15 or 20 minutes to get through all of that. And then finally, a link to the Baltimore Restaurant and Tavern Assistance Grants, which you just mentioned, Shelonda. So with that, no other city updates. I'll turn it back over to you.
Thank you so much. I know you always come well informed, especially with the link. So please, for everyone, take advantage of what's in the chat. We really want to make sure that we're bringing this information, not so that you just hear it, but so that you're able to act on it. So thank you, Councilman, for doing that. Now it is my pleasure to introduce Dr. David in Maine. He's the president and CEO of Mercy Health Services. Mercy, if you don't know, you must be living under a rock, but it's an acute care teaching hospital affiliated with the University of Maryland School of Medicine, located right here in the heart of downtown. I cannot talk about Mercy, Dr. Maine, without mentioning Sister Helen Amos. You know, she is a board member. She was the former board chair. I love her tremendously, as does everybody else. And so just the fact that you allow her and have partnered with her to really continue to work with us in the way that she has, I think the partnership is amazing. And so I thank you both for your leadership in that area. But in addition to being an important institution in our neighborhood, we know that Mercy was one of the first hospitals in the state to ramp up a special COVID care facility, something that I know we'll talk with you about a little later. And while we know you've been in existence, Mercy has for 145 years, Dr. Maine is the first physician to lead the health system, which is a big deal. And so we know, in addition to being an exceptional administrator, you are a board certified anesthesiologist. I should have did that first. And pain medicine. Let's just go there on there. So Dr. Maine, please welcome to our show. And then you can clarify anything that I couldn't say well, didn't do well. We're just happy to have you here today. I thank you, and Councilman. Sure. I know you have some questions for him. We will hear and welcome him. I want to encourage everybody to please put your questions in the Q&A box in there, as we always follow the same format. Councilman Costello he'll give you the hard questions, Dr. Maine, and then I'll come back with the questions that we get from our audience that are sometimes a little bit easier, but I know they're, waiting with bated breath to talk to you. So Councilman Costello, if you would take it away.
Thank you so much, Shelonda, and thank you for taking one for the team and pronouncing Dr. Maine's background. I was struggling with that this morning as I was prepping for this, so I'm not even going to attempt to say it.
I'm thinking it's anesthesiology, but it's so hard. So let's.
You nailed it, Shelonda. You nailed it. It's perfect. But I appreciate, Shelonda, Councilman, the privilege to be on and share some information with the community. So thank you for that.
Thank you so much, Dr. Maine. We really appreciate it, and certainly appreciate everything that Mercy Medical Center does for our region, for our city, and especially in the core of downtown. You guys are just an incredible partner, and downtown wouldn't be what it is without Mercy Medical Center. And again, I got to give a special shout out to Sister Helen for all her work over the years and her work with Downtown Partnership. So we'll get started off a little easy. Tell us a little bit about your take on the current COVID environment. How are hospitals managing through all of this?
Well, when I reflect a little bit back in February of last year, when we started to see this coming, we often said there's no playbook, but we really did have a playbook. It was back in 1918, and I would say, thankfully, things have improved considerably, as you know, and everyone likely knows that this is the third wave we're in. It's just like the influenza pandemic. The first wave was in the spring of 1918, the fall of 1918, which was the worst wave, in the winter of 1918. And here we are in the third wave. We seem to be improving. Here in Maryland, the second wave was actually smaller than the first wave. That's a little bit different than what the nation saw, but the third wave has taken the cake and has been obviously an incredible challenge. We peaked here in mid-January, around mid-January, I think January 12th, in terms of hospital capacity, which is something we have watched closely, and the number of patients with COVID-19 that are getting their care in hospitals. Since that time, it's dropped nearly 30%, which is terrific. Over the past 2 weeks, it's actually dropped 16%. So really, really good sign. The current census in the hospitals, I think the numbers that come out today will be around 1377. So again, that's great, and a big drop from where we were above 1900 in mid-January. Cases are also starting to drop. Cases peaked at around, in terms of a 7-day rolling average, at around 3,000 a day. That has dropped to around 1,400 a day. So that is great. And the other factor that we watch really closely is hospital capacity. You've read about some really just horrifying stories in California, obviously in New York, and hospital capacity has been a major focus of state, local officials, and obviously about the hospitals, and that has been able to maintain providing services that are non-COVID related, as well as providing exceptional COVID care. So overall, I think we're breathing a bit of a sigh of relief, but the fight is certainly not over. I think Maryland overall is in a good position as we kind of work through this third wave. So,
thank you, Dr. Maine, and just delving down a little bit into those numbers. Are you? I mean, it sounds somewhat encouraging to me. Again, I'm not a public health expert, but it sounds encouraging. Are you encouraged by it, and do you see it continuing in this direction?
Well, I'm absolutely encouraged by it. I think the one thing that I would say is again, the fight is not over, so that continued vigilance and sacrifice will be necessary, I think, to get through this critical period. And this is just such an incredible period. We're in the third wave. Things are starting to come down. Hospital capacity has been maintained, and services have been provided at the highest level. And we're rolling out vaccines, which come with their own challenges. So there's lots of things happening, and we don't want to lose focus on the goal to get through this with a community that is healthy, and obviously we want deaths to go to zero as it relates to COVID, and we just don't want to lose focus of that. And obviously that's a risk. We're all hitting a wall of sorts, regardless of whether you're in healthcare or any other industry. This has been extraordinarily hard. I shared just with our team last week at the end of one of our senior executive meetings how, I felt like, we're hitting a wall here, and how to work through that together to make sure that we can push through. And so that's something we all have to do, and we all have to stay vigilant and continue to be mindful of the broader goal. There's nothing that has been so galvanizing as COVID-19. We all have a common goal, and it's important to remember that and kind of keep at it.
Thanks, Doc. So walk us back to the beginning of the crisis. Can you give us a little insight into Mercy's response, and how you were able to scale up so quickly in terms of patients, staffing, operations, et cetera.
Yeah, sure. Well, again, I think when we started seeing cases in Asia and then come to Europe, we knew it was coming, and there was just so much unknown. The uncertainty was kind of top of mind, and we were just trying to learn as fast as possible. And information, as everyone knows, was changing rapidly. It was nonstop, and our focus, I would say, was threefold. Number one, we wanted to ensure that we could take care of the community we serve. We care for over 300,000 unique patients, over 100,000 primary care lives in Baltimore City and the greater Baltimore metropolitan area. And we wanted to make sure that we could maintain care for them at the highest level in a time of incredible uncertainty. It felt like a tsunami was coming. In fact, I've said that many times. It felt like a tsunami was coming, and we've been given this warning, and we were just trying to prepare the best we could. The second issue, and it still relates to that, maintaining the care for our patients, is we needed to take care of our workforce, who also was uncertain and maybe had anxiety related to that uncertainty, and concerned about are their jobs going to still be there? They needed reassurance, and we needed to make sure that they were safe and ready to work to that first issue of caring for our patients, our primary goal. And then we needed to develop protocols to rapidly adapt, and we really obviously couldn't be rigid. We needed to be flexible, recognize that this is different than anything we had seen before, and so we had to think differently in terms of how we did that. And the first thing we did is we heeded the call of the governor about increasing capacity. We were the first hospital to apply for a certificate of need to expand capacity. That was a big step to add 32 beds to the hospital that, in a project that normally would take 6 to 9 months, it was completed in under 75 days. So that was a critical first step to ensure that we were ready to meet the need. And then in terms of developing protocols, whether it be screening, how do you screen? Where do you screen? How do you do that to ensure that we're keeping in mind the broader goal? How about testing? How do we do that? We have patients all over the region, and we certainly didn't want everyone coming into the hospital to get tested. That was not going to work for safety purposes and also to meet the needs of our patient population. And then, of course, purchasing, reinventing supply chain early on in the pandemic, as I'm sure every other hospital was doing. We're going after every possible lead for personal protective equipment. We simply did not want to put our team and our patients in any risk, and we were really creative in sourcing personal protective equipment across the nation and world. So we're really proud of the team in terms of how we were able to position ourselves from a personal protective equipment side. The other issue, telemedicine. How do you provide care when people we weren't sure how they would manage in the offices, but if you have hypertension, if you have heart disease, if you have diabetes, you need to have a connection to your doctor. And so telemedicine was a big deal. We actually brought that up in about 2 weeks, a little bit under 2 weeks, a credit to our information technology team as well as our clinicians in adopting a embedded program that was integrated to our electronic health records so quickly. So that has been key to our success and very important. And then lastly, communications. How do you communicate with your workforce, with your patients, with your staff when things are changing so rapidly? And the key from that standpoint was just to be transparent and it's okay to say you don't know. Sometimes you don't know, and you're doing your best. And we really were aggressive about communicating frequently in different ways and to different subsets to make sure that we were providing the most appropriate information so people could understand where we were heading. And this all came kind of before the shutdown of elective cases, and all those elements that I spoke to really positioned us well to emerge from that quite strong. And of course, evaluating our liquidity to make sure that we were in a position to manage through the acute period, which is something everyone had to do, and certainly healthcare was no exception. So.
Well, there's no doubt that Mercy has really stepped up and just done an incredible job under some very trying circumstances. Shelonda, just a reminder for our audience, if you have questions for Dr. Maine, punch those in the Q&A box, which you can find. There's a little window at the bottom, or you can put them in the chat. We'll make sure we get to those when we get back to Shelonda. I know we had a couple questions in advance. Doc, talk to us a little bit about the different variants that are out there. We've heard a lot about the African variant recently, and how that impact recovery.
Yeah, variants are a hot topic. There's a few variants. There's one of actually in the U.S., a California variant that was discovered, but you've heard a lot about the U.K. variant that kind of showed up in the fall in Europe, the South African variant, the Brazilian variant, and so there's a number, and it may be worrisome, and perhaps it should be worrisome in some respect. But that being said, it's a phenomenon that is expected. Viruses work they spread by replicating themselves, and it is often imperfect. It's not a perfect process. So mistakes can happen when they replicate. It alters the genetic code, and when it does that, sometimes viruses die. Sometimes it can kill the virus, but sometimes it can change the genetics such that it becomes more easily transmissible, or even can evade immunity, which, if you've been reading the papers, you'll hear about that. So this is relatively expected in terms of how viruses work, and let's not forget, COVID-19 is already easily transmissible. So you just have to look at New York, California, or here in Maryland to recognize that. But these changes, these variants, whether it's a tiny part of the genetic code or a larger part, can make it more easily transmissible. And so that's the obvious concern. So I can't talk about variants without talking about the importance of vaccinations, and it really kind of punctuates the importance of rolling out vaccines in an effective manner. It is really the key to prevent replication, which then prevents variants. So it's incredibly important that continue and grow in terms of its effectiveness. I will add one little issue on the UK variant, which is probably the closest to becoming a dominant strain here. When that occurs, I don't know, but we you've read about it here in Maryland. It's in many states, and it will likely evolve into a dominant strain, just like any other virus would when a variant arrives. That variant was first detected in September in the United Kingdom, but didn't really cause a surge until December. And so it really questions, was the variant itself the main driving force? I don't think it is totally clear. The UK went through a national lockdown in November. That drove cases way down. They then opened up in early December around the holidays, as well as at a time when humidity had dropped significantly, and then there was a significant surge. So the country opened up at the exact time that transmission probability was going to increase, and that was compounded with holiday and Christmas gatherings. So, I think we're still learning about all of this. We again know the virus is really transmissible. You saw how easily it can spread. This may change that a bit, but I think it all needs to be put into perspective. And I would say the focus around vigilance and vaccination has to be top of mind to manage through that issue.
Thank you. I think that's a perfect segue into our next set of questions here. So first, should pregnant women receive the vaccine?
Well, so pregnant, and it's funny you asked that. We actually just sent a video out to some of our staff with one of our obstetricians discussing this exact issue because it is unclear. Pregnant and breastfeeding women were not enrolled in the COVID-19 vaccine trials, and so there is limited data about the safety. That being said, the CDC does recommend pregnant women, lactating women to be offered the vaccine. That's a view that's shared by the Society for Maternal Fetal Medicine. It's a view shared by the American College of Obstetrics and Gynecology. So all those groups agree on that statement. And there's really no theoretical reason why mRNA vaccines, the two vaccines approved in the United States through Moderna and Pfizer, would be harmful to a mother during pregnancy or to a breastfeeding infant, for that matter. There was some early data that was reassuring on the Moderna vaccine, where they looked at pregnant rats and to see if there was any embryo changes, any changes in development occurring as a result of the vaccine, and there were none. So there's a little bit of reassurance in that respect. But again, pregnant and breastfeeding women were not enrolled in the vaccine trials. So what should you do? At the end of the day, it should be an educated decision. What's your risk? If you are pregnant or breastfeeding and can work from home and really aren't putting yourself in any riskful situations, maybe you would say no. If you were pregnant and working in a restaurant, a hospital, a public safety, grocery store, then you might want to go towards the route of vaccination. But I think it's all about making an educated decision. And at the end of the day, pregnant women should know that pregnancy is a risk factor for severe illness to COVID-19, just like it is to influenza and many other viruses. So and when you put that all together, I think the short answer is there's no reason to say it's not safe. There is some reassuring data, and it depends on your individual situation. I hope I answered
it. You did. So one of the things that we've heard, I think some confusion on, is how long the vaccine works for. So once you're fully vaccinated, after you get that second dose, what are you hearing? What are you seeing? What guidance can you provide on that?
Well, I think the first thing, I guess I would be remiss without first talking about vaccine safety is part of this. We've now vaccinated over 50 million, maybe 60 million mRNA vaccines have been administered thus far. So there's been a lot of it's pretty clear that they're very safe. In terms of how long they'll provide immunity for, they've only been tested since the summer of 2020, and we don't really have clear information about the durability of protection. The data from the early trials suggests antibodies, so the army, if you will, against the virus for at least 4 months, nearly 4 months, but then they decline after that. And what that means is not clear. I think anecdotally, it looks like there's protection well beyond that, because there's two parts to the immune system. There's a B cell and a T cell, and they provide different avenues of protection. So we will know much more about that as time goes on. But we know it provides significant protection. If you've read about people who've had COVID and what the immunity to that looks like versus getting a vaccine, I think you'd lean towards the vaccination. It's a better way to protect yourself. And it's certainly a much better way to protect yourself against variants. So, unfortunately, I can't give you a concrete answer on that, but outside of what the data shows at this point.
Thanks, Doc. So as Shelonda knows, I go off script every webinar for at least one curveball question. So here's your curveball. I think the inner geek and inner nerd in me has come out as I've continued to read about this and learn more about it. And one of the things that I've found very intriguing is I think I read somewhere that the Pfizer vaccine needs to be stored at -70 degrees Celsius. Just to frame that for our audience, that's significantly colder than winters in Antarctica. Why is that the case? And is that different from most vaccines out there to other diseases?
I'll take the easier question, which is that different from other vaccines? And the answer is yes. As many people know, you go to your pediatrician for your kids' vaccines, or you go to your primary care doctor for your vaccines that you might get as an adult, your shingles or influenza for that matter, and they're stored in normal refrigerators, just like you keep in your house. So it is different, and it speaks to some of the challenges, obviously, that it would be really difficult for certain facilities to manage the Pfizer vaccine simply due to its storage requirements. And that poses challenges not just here in Maryland, but just imagine rural America where access to healthcare maybe is more difficult than at most driving 2 hours. It could be much more difficult in certain areas, and so storage requirements become a really big deal. And in terms of why that is, I can't answer that, at least in a way that would satisfy me. But it does result in a breakdown of the mRNA, and renders it at least not effective or not consistent with how they conducted their studies. So. Right now it's just the way it is, and we can't deviate from that unless the company studies it in different storage requirements.
It's helpful. I just find that very intriguing as we learn more and more about the disease and about the vaccinations and how they're produced. One of the challenges that we've seen and heard, especially in Baltimore City, is some reluctance or hesitancy on the part of the public to trust the vaccine. We know that Mercy is dealing with the same population in terms of Baltimore City residents and folks from around the region. Can you talk a little bit about how Mercy is dealing with that hesitancy and trying to combat misinformation about it and help educate people that this thing is safe and this thing is very necessary?
Yeah, that is a huge issue, vaccine hesitancy, and suspicion about the safety and efficacy of vaccines is longstanding. You can just think about the MMR vaccine and links to autism. That was based on a paper that was non-scientific. It was retracted. It has been consistently discredited, but the messaging around autism and MMR vaccine still persists and comes from some celebrity figures who have no knowledge of how these vaccines work or the studies or what have you, and it just percolates into society. There have also, to me, this is all not just about vaccine. There's mistrust about the science of medicine that is longstanding. You don't have to look very far just to think about and read about the Tuskegee experiments and the syphilis study to understand where that mistrust was born and why it persists today. But at the end of the day, I will say that medicine is humbling, and as a patient, as a doctor, as an executive, it is all very humbling, and there is no one-size-fits-all approach to this. There just isn't, and we need to understand, and we as an institution have taken that approach, and you just need to respect the process. So our process has been understand concerns and try to address them. Sometimes you do them in larger groups, sometimes you do them in videos, sometimes you do them on one-on-one, and you do it in a non-confrontational manner, and you bring people along with reliable information that can slowly but surely fill in the gaps of understanding. And at the end of the day, it's about protecting you, protecting me, protecting our community, protecting your loved ones, so that we can get back to normality. But if people really thought that we were going to have a line that this unlimited demand early on in the vaccine rollout, I think we were just maybe misguided a little bit. You just have to think about the influenza vaccine. The influenza, we gave 150 million doses in the United States, one of the most studied vaccines and safe vaccines. 60 million of those are from people under 18. So you take those out, and so just 90 million adults get vaccinated influenza, and much of those in mandated workplaces. And that's influenza. So what did we think was going to happen with a brand new vaccine that has come to fight one of the deadliest pandemics in history? We knew it was going to be tough, and we knew we were going to have to educate and be patient, and then that will continue. So,
Dr. Maine, I know we all have our work cut out for us as we try to address that, and really appreciate what is clearly a very thoughtful approach that Mercy Medical Center has taken. Shelonda, I'll jump back over to you. I know we have some questions coming in from the audience.
We do. Thank you so much, Dr. Maine. This information is very, very, very timely. One of the things I'll start with.
My pleasure.
Out of order a little bit. Thank you. Just because I know we were just talking about sort of the speed and all of that at which the vaccine was developed. One of the questions we got in earlier, it says the speed of vaccine development has been incredibly fast. Do you think this will change the process for how medicines are developed and created in the future?
I think the vaccine, it's true in the sense that the vaccine, Moderna's vaccine was ready for trials in 42 days. So it was very quick. And that's because the virus was sequenced already. It was because of SARS-CoV-1 from many years back had similarities, had been studied, and the mRNA vaccine technology has been studied for a long time, and so there was a lot of work to get to where we are. And then in terms of the size of the studies, these are one of the most robust studies in vaccines ever conducted. So the studies are really strong. And so we should feel really good about that. It should be better now than it was a decade ago, and it certainly should be better than it was 25 years or 50 years ago. So we should feel good about that, and the science is incredibly robust. I do think this will change medicine, though. I think these mRNA vaccines are incredible. They are a gift of science. And I think the future is extraordinarily bright, not just for viruses, but for other applications, potentially treatments for certain cancers are possible, as well as other very clearly targeted diseases where you can sequence and then really specifically target an immune response. So I think the future is really bright around this technology, and is exciting both from a scientific perspective as well as as a patient in terms of what's available to you from a healthcare perspective. So I think we should all look to it with a optimistic eye.
That's exciting, reassuring to hear. So thank you for that.
Sure.
Some of our questions are specific to Mercy. One of the first is from Rosemary. She asks, will doctors at Mercy have the vaccines to administer to their patients, to your patients?
Yeah. Well, so first of all, I think as a physician, as a healthcare executive, and as just a human being, I want everyone to get vaccinated. And I certainly want all of our patients to have access to a vaccine and get vaccinated. Vaccines don't help anybody if they're sitting in a freezer. They help when they're in arms. And we have distributed a nearly all of the vaccine that we've received from the state. We are partnering with the Department of Health here in the city, but it has been challenging to get some folks in certain times simply because of either vaccine hesitancy, choosing simply not to take it, and also I think there is some confusion about where to go. How do you get it? And that's a challenge that I think state and local officials, as well as us here, are trying to work through. But we absolutely want to be able to vaccinate the patients that we care for. It's almost an obligation, but right now it's a real challenge with supply. Right. There was not unlimited demand when this first rolled out in phase 1A. Which I'm sure you've read about. It wasn't, when 100% of healthcare workers did not take the vaccine. There were issues that we already spoke about. But as we've opened it up, that demand, it as you would expect in the group of elderly, has skyrocketed, and there just is not enough supply right now. Every week I'm hoping that gets better, and we have seen some improvement, which is good to see. But we have a long way to go. And I think the mass vaccination sites will be critical. We certainly want as much vaccine as we can get our hands on to do just that issue, to vaccinate patients here in Baltimore City and the greater metropolitan region.
No, thank you. And that message is pretty consistent. I know they even had an article in the paper today recommending that people get on as many lists as possible, just because it's a little bit, hard to figure out. But to make sure once you get it, you take your name off of those lists. This may be why.
Yes, that's key. That's right. Absolutely key.
Trying to figure it out. And we're trying to help make sure that we can use Downtown Download and other resources as ways to make sure we're disseminating that information. This next question, Dr. Maine, may be a follow-on to that. It comes from Nancy, and she's asking, we're saying that Mercy is one of the only major hospitals in the region without an online vaccine registration. She's asking why that is.
Yeah, we do have a link. If you go to the Maine website that lists the vaccine sites, it'll then connect you to Mercy, and then a number to reach out to. And for us, that's just been a more effective way of controlling the number of appointments, simply because we don't have that much. And it's just been a little bit more effective for us to connect to our patients and not book patients that we can't provide a vaccine to, and rather we try to steer to other sources as we know they come out. So I think it's something that we're working on and working through, and how we exactly create these access points. But that's how we're looking at it right now.
No, thank you tremendously. This question, and this is probably a little bit more self-serving, so I'm going to try and lead your. I'm just kidding. But as people can see, I quite often take these webinars in the office, and I do it because I know we've gone through similar protocols that I know you guys did, and trying to make sure that we can keep the environment as safe as possible, right, in the process. But we know that there are some that really need to be in the office and have to come back to work. And so, trying to model that behavior. Is there sort of a golden number or a thought around how much of the population needs to be vaccinated before we feel we can fully reopen businesses?
That's a toughie.
I know. And I want to say this, and I'm just kidding.
Well, I don't think there is a hard, fast number. I think, if you listen to Dr. Fauci, who is a national expert, we're targeting 70 to 80% of the population to have true normal environment. But it is likely a process and kind of a graded incremental step process that will occur, much like that you're seeing here in Maryland. There are no easy choices here, but it has to be incremental, and you have to be flexible. You need to know that if you move too fast, there's a good chance you're going to have to reimpose some pretty draconian things. So you can't move too fast, and the saying, we're all in it together. We are all in it together, but we don't all experience it the same. And we all just need to take our individual responsibility and be as safe as possible. And it'll help us get there much easier. Our vigilance over the next 3 months as these vaccines will pay dividends on our ability to have a normal summer, if you will, and revival of the economy. It's all critical to the events that are occurring now and how we manage that. So again, I don't think there isn't a hard line. It's not like once you hit 40%, all of a sudden you can go there. I think it has to be thoughtful. It has to be incremental.
Thank you so much. So for my team, does that mean, no, I'm just kidding. So no, I'm reading between all of the lines. In your, I want to applaud the business community. I think people are being very thoughtful, right? Because there's a balance in what has to happen. And so really appreciate your leadership in helping us get there. There are some things in the Q&A just that are complimentary of you. So Regina Green is just thanking you. People are thanking you and the Mercy staff continuously. And so we want to make sure that we raise up those as well. I want to say this next one comes from Kimberly. She says, thank you for the webinar. Thank you to the staff at Mercy for helping make her feel safe during her surgery over the summer. She was wondering if, when the vaccines become more readily available, if Mercy doctors at the Mercy sites, such as Ricestown and Timonium, will be able to administer them, or, if patients will have to visit the Maine hospital sites or like the community center.
Yeah, I think obviously our goal would, and I think state and local officials' goal is to have vaccine on every corner possible and be able to vaccinate everyone. So I think you'll likely see changes like that if and when the J&J vaccine gets approved. As you know, they had an emergency use authorization application, and they'll come for their hearing, and I do anticipate that is likely to get approved, and that is a single shot, much easier from many of these logistical challenges of storage and multiple doses. So I think that is coming. I wish it would be here yet. I wish it was here now, but it's not there. But that is coming, and as soon as supply allows it, and the mechanics of the individual vaccines allow it, you should see it everywhere. And because at the end of the day, again, we want vaccines in everyone's arms. It's so critical, and we just have to continue to sharpen the efficiency around vaccine administration and work on hesitancy, but you can't let that hold up administering doses. So it has to occur in tandem, and that's really important.
No, I appreciate your candor on it. I know our team, we have a lot of frontline workers, primarily African American, and there is an increased amount of vaccine hesitancy for the reasons you talked about early on. And so I know there's been an intense effort along with the health department and others to be really targeted in the messaging. So you're spot on. I think you may be able to come off the hook for this next one, Councilman. This one might be directed to you from Mary in Audubon, and it's asking, or maybe it's a combo, but it's asking, what is the city doing to ensure our residents at senior citizen buildings are being vaccinated, especially those residents with mobility challenges?
It's a great question, Shelonda. The administration, Mayor Scott and Health Commissioner Jaraza actually announced a new strategic partnership. I want to say yesterday or Friday. I've included a link to that. But in short, a scheduling form is going to be sent to independent living facilities like our senior buildings, which we have several of in the city, to gauge interest in mobile clinics slated for the next 2 months. Scheduling is going to be confirmed weekly based on vaccine supply. In the coming weeks, the health department is going to deploy a public dashboard highlighting mobile clinics around Baltimore City. The first one actually took place on January 29th in Cherry Hill Senior Homes. The health department and partners are working to rapidly scale up mobile efforts with a goal of deploying up to 20 mobile teams at a time by midsummer. So I think we're going to see that continue to roll out. We know that Mayor Scott has made that a priority of his administration's deployment of the vaccine to make sure that we are getting that vaccine to our most vulnerable residents. And that certainly includes our senior citizens that live in the city. Thanks, Shelonda.
Thank you so much. That was pretty thorough. I don't know if you have anything to add to that, Dr. Maine, if we're going to go on to the
No, you know, I would say that's great news. I mean, that's wonderful news, and you know, bringing it to people is critical here in the city. You got to do that. So it's great news.
Thank you so much. So coming back to you, this next one, it says, everywhere you look, people are anxious. Parents are stressed. I know some people worry about every ache and cough, whether it's a sign of COVID, especially with the economy being tough. What advice do you have to help people sort of maintain their mental health during this time?
Yeah. Oh, gosh, that is it's so important for all of us, and this speaks to COVID fatigue, hitting that wall, and the anxiety around just what you described. I mean, I'll tell you, you know, when I've had a sniffle, I worry, oh my gosh, do I have COVID? And what do? You get tested, because you can get tested, right. and you protect everyone. So I think to answer the first issue about whether you have a little cough or this, get tested. It's easy, it's simple, you can get tested everywhere. There is incredible access to testing, and it is a tool that you should use and we should use. The other thing I'll say about how to just maintain your mental health is you know, think about or write, and this is an exercise that I have shared, but write down what has been good about this pandemic. What have you gained? What has been something that you don't want to go away when quote unquote normal occurs? And you know, for some of us, it's when I ask you how you're doing, we really mean it. We want to know how you're doing. We know that this is not, there's nothing normal about this. And how you feel about, you know, the time that you have with your loved ones and your family or your bubble, that's a special, unique thing. And I think you have to leverage those smaller things that aren't really that small, but certainly in a time when isolation is an issue, you know, not seeing your certain family members. I have a friend who hasn't seen their parents for a year. I mean, that doesn't sound good to me, and that's a stress. And so I think trying to pull out the silver lining is really, really key, and you kind of have to do it intentionally, because this has been a hard, really, really hard time. And you know, from my perspective, I'm so inspired by our staff, our here at the hospital, and you know, when I picked up takeout and I see the chef working and the people at the restaurants working, and I'm just inspired by the ability to carry on and do it under these incredibly hard circumstances. And that inspiration, I think, helps as well.
No, you're right on point with that. Outside of the extra 20 pounds, I probably gained all of the other stuff, like Downtown Download, right? Like having you the ability to have the CEO come on and share this special information. I think these things weren't as prevalent before, and they've become commonplace. And I thank you, and our audience thanks you as well with that. We have two other quick questions to get in, and then I know I'll come back to you, Council. The first is the vaccine safe for people that are allergic to penicillin?
Yes.
Okay, good. That was a quick yes. Deborah Claxton, yes, for that one. And our last official one that's in here, although we have a couple more, it says, since our scientists have proven that we can develop and manufacture vaccines and other medications in a more timely fashion, will this help decrease our dependency on medications from other countries? And that's coming from Jetta Queen.
I don't think I can answer that fairly. I think our reliance on beyond the U.S. Market for medications is broad, beyond obviously just the science. The science is extraordinarily strong here. So I think I don't think I would say no. I would not call that an immediate connection. I think our work on vaccines here in the U.S. has been incredible, and I think it will help the world. But in terms of our reliance on partnerships with other countries for supplies and medications and so on and so forth, I don't think so necessarily. I think that's a much broader issue. So, Shelonda, I would like to add though, for just as an aside here, we're here nearly a year since the start of this pandemic, and if you have healthcare needs, you just got to make sure that you're seeing your doctor and taking care of your blood pressure, your glaucoma, your COPD. If you have any lung problems, heart disease, diabetes, you just need to engage in your care and do not put it off because of the current situations. I think. And Mercy, certainly, we think the hospital and our ambulatory sites are the safest place possible for patients. And I think I think in healthcare in general, I spoke about the pandemic as a galvanizing force with a common goal. So the goal is to care for people, and your health well-being extends beyond just COVID. We're seeing less cancer diagnosis, things that are very alarming to us, that suggest that there's been changes in behavior that continue to persist. So I would just encourage people to see your primary care doctor, make sure that you are keeping up with your own health care. It's critically important. So.
Thank you for sharing. I know we wanted to sort of close out in that way, and so as expected, you're ahead of the curve. With that, thank you enough for your time, for your knowledge, for being a center point in our downtown. I mean, downtown is just so thankful to have an institution like yours. And so thank you for that. Councilman, I'm gonna come back to you for some final words as well.
Thank you. And Shelonda, first and foremost, thank you for asking the penicillin question. That was on my to-do list to call and ask about. Because I am allergic, so I do appreciate that. Doctor, I want to take a point of personal privilege here and give a shout out to my doctor, Dr. Mary Harris at Mercy, who is just an absolute rock star and who I love to death and so am so appreciative for. And two, I want to take a moment just to thank Mercy Medical Center publicly for everything that you do for our city and for downtown. Everyone from the nurses to the staff, to the janitors, to the doctors, to the surgeons, all the way across the board. It is incredible to have an institution like Mercy Medical Center in our city. And finally, I want to take a moment to remember Joe Costa. who was a friend of mine, a constituent who lived in Bolton Hill, and take a moment to uplift his husband, David Hart, and Joe's family. Joe was truly a frontline hero in this battle. He led the critical care division at Mercy, and one of the kindest people I've ever met. So just want to take a moment to remember him and uplift his husband and his family. Thank you, Doctor. Thank you so much. And
You're
Shelonda,
welcome. You're welcome. Joe, Dr. Costa gives us strength every day. Mercy is an incredible family committed to the community and providing the highest level of care. We have a lot of stars, like you mentioned, and it's just really a privilege to be here to speak with you and share information that is so critically important. So thank you for that.
So thank you. We are at the end of our webinar. That hour went by extremely fast. I want to thank my team for helping keep it seamless as always. Nicole, Lauren, Mike, thank you. We could not do this. The councilman and I talk about you guys all the time, so thank you for that. My board members, led by our board chair, Mark Wasserman. I saw several on here. Of course, Dr. Maine, we share Sister Helen, so she's been on, so I thank you for her leadership. Thank you, Sister Helen, for tuning in. Alexa, Analea, Christine, Lou, I saw several names on here. Thank you to that, to the staff, and everybody else who tuned in to ask the questions and just get engaged. We are stronger together. We know that. Dr. Maine, you really enhanced and elevated that message today. And so I thank you for your time. We will see you guys next month. We know with our next Downtown Download, we have a feature with Delali Daraza. He's the CEO of Fearless. He's also one of the sponsors, the primary presenting sponsor of our Boost initiative. But his organization came to downtown with the Tech Connect grant. One of our Tech Connect grants started there, and he's now $40 million Black-owned tech firm that's growing other organizations. So we want to spread those messages as well. So we will see you on March 9th for that. But until then, please continue to visit us online at godowntownbaltimore.com and tune into our social media sites. We want to make sure that we're giving you the latest and greatest information to help you continue to thrive. Have a good week. Thank you.
Thank you. Thanks so much.